If you're pregnant, don't take Tylenol.
President Trump and health officials on Monday tying acetaminophen, the generic name for Tylenol, to an increased risk of autism, despite decades of research that says it's safe. Acetaminophen can help with fever and pain relief and is taken by more than half of pregnant women worldwide. Trump now saying officials will recommend limiting Tylenol during pregnancy unless it's medically necessary.
In cases of extremely high fever, that you feel you can't tough it out, you can't do it.
The announcement comes after New York's Mount Sinai published an analysis of more than 45 studies last month, with some finding acetaminophen use during pregnancy may be linked to an increased risk of autism, but urged further study. Many other large-scale studies, including one published in JAMA last year, found acetaminophen use during pregnancy was not associated with children's risk of autism, ADHD, or intellectual disability. Ahead of the administration's report, the maker of Tylenol, Kenvue, strongly disagreeing with the White House, saying in a statement that a decade of rigorous research confirms there is no credible evidence linking acetaminophen to autism. Stephen Fleischman, doctor and president of the American College of Obstetricians and Gynecologists, supporting that.
Our recommendations are, if you need it, it is a safe medication for you to use in pregnancy.
President Trump also saying without evidence, he thinks vaccines like those for measles, mumps, and rubella and hepatitis B should be spread out over time.
Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life.
The American Academy of Pediatrics calling that dangerous and misleading. Adding spacing out or delaying vaccines means children will not have immunity against these diseases at times when they are most at risk. As for the next steps, the FDA is sending a letter to doctors with its concern about acetaminophen and hoping to change the safety label on the drug. The FDA is also going to approve a prescription drug called leucovorin as a treatment to alleviate the symptoms of autism, despite little evidence that it works. Savannah and Craig?
All right, and thank you. I want to turn to NBC News medical contributor Dr. Natalie Azar. Can imagine being a pregnant woman right now and being like, what should I do? Politics aside, what does the research say? Is there a link, a causal link, or is there not?
Right. So the headline very clearly, Savannah, is that there have been no studies that have definitively shown that Tylenol causes autism. To be fair, the research has shown some inconsistent results when it comes to, is there potentially an association, some strengths, strengths as well as limitations of all of the research that we have up to date. I think it's very important that the American College of Obstetricians and Gynecologists reaffirm the safety of Tylenol for use in pregnancy, especially in the setting of fever, which we know can be harmful for both the baby and the mother. And it's very important to highlight, too, that autism is very multifactorial, sure, right? There's genetic issues, there are environmental risks. And so trying to sort of tease out or pinpoint a singular cause, you really can't do that. As Anne made a point in her piece, the FDA's letter to physicians was actually much more measured and said, we have not shown a causal association, but potentially a link that requires further study. And they also encouraged women to talk to their doctors about using Tylenol judiciously in the setting of fever, which is important.
Yeah, if you don't want to use Tylenol, are there options available that are as effective?
Unfortunately, no, which is why we're even having this conversation. There is no safe alternate or substitute for Tylenol. People might think, what about Advil or full-dose aspirin? Absolutely not. NSAIDs are not recommended. So that is the reason why we have safely used Tylenol really for decades in pregnant women. And again, to reinforce this messaging that fever as well as severe pain is not safe for mother or baby, but that doesn't just mean that you use Tylenol liberally. We say this a lot in our segments. And I say it again, this is one of those situations where you do want to talk to your doctor, because I think women will feel reassured about what we know and what we don't know.
Okay.
Dr. Azar, thank you very much.
And we're going to continue this conversation coming up in the third hour as well.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC, or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.